So Angelman disease is a genetic disorder which typically mostly affects the nervous system. And by genetic disorder, that means, of course, one is born with the disease. However, typically the diagnosis is made later after birth, although now you can make the diagnosis by genotyping much earlier on. The typical features that we see with this disease in many of these kids is that they'll tend to have, sometimes they have a small head, and typically they have severe intellectual disability and some developmental disabilities as well. We find that they have difficulty speaking, balance. Some of them will have seizures. In fact, what we find, at least in our clinical trials, is that many of the patients have a history of seizures. Almost 100% of the patients have a history of seizures, and some have sleep disorders as well. Now, what you'll find with Angelman's is that the patients tend to be dependent. So they require full-time help almost throughout their lives. And they do have a full lifetime expectancy, just like other people without the disease, but you find that the disability is so severe that in most cases they require full-time care throughout their lives. So that's really a brief intro in terms of the disease itself. The gene that's affected is a UB3A gene, and typically this is inherited from the father. So it's the father's gene that's actually defective. Either there's a mutation in that gene, or that gene itself is actually not able to function properly, and that is what causes the disease itself. Currently, there is no treatment for Angelman's, and so you'll find that most of the treatments that we have are treatments that tend to address some of the issues that the patients have. So they might have physiotherapy treatment as well. In addition to that, for sleep, they may have sleep medication, and for seizures, they'll typically be on multiple anti-seizure medications as well. So this is a real unmet need currently in our country and in our population as well.